So I'm 30 years old. I live in Germany. I work currently as an administrator at a big research institute for molecular biology here in Heidelberg. And I really love reading. I love writing. Writing is a big hobby of mine. I was a freelancer, so I would go to different companies and teach business English. And I had to stop this job because I could not function with my disease. So I was often sick, extremely often, and then I couldn't work. And as a freelancer, I wouldn't get paid. Stressed because of like my job, stressed, like guilty because I couldn't function normally. Yeah. I also had anxiety issue and depression, but at the height of the disease, you go to the supermarket and you're afraid. Like, what if you're in the middle of the supermarket and you have to go to the bathroom and you're in so much pain? It's not even so much that, it's just the pain, like extreme physical pain. And it's really, you get fear. Don't think they just didn't take it seriously, because they also don't know me as a patient, like you're there and they come into your room and they're like, oh, hi, I'm this and this. I'll be your surgeon. Bye-bye. So they don't know this history of like the extreme pain, et cetera, et cetera. And so they were in the surgery and they saw that the bladder was fine. It looked great. They kept telling me like, oh, you have a healthy bladder. I'm like, are you fucking insane? Like, I can't go to the supermarket and you're telling me I have a healthy bladder, They're like, you're so young, you're healthy. They kept saying me like, you're healthy. Well, fuck you. I took it for about 3 months before I really noticed the effect. And now I have been on it for, I think, a year and a half, or maybe little bit shorter, maybe a year. And it really works for me. And I do not have side effects. It's a bit tricky because you have to take it 3 times a day and you have to take it basically try to take it on an empty stomach. So that's a little bit tricky, but honestly, it's a tiny sacrifice. I don't mind at all. So I have good experience, yeah. The biggest thing, right? Like, you just look like a healthy person, so why would you be in a complete panic and ask to use the bathroom? Like, just go away. So an app would be very useful with the latest research, or because I think there is some traction, all around the world. People are studying, so with the latest news, that would be good, actually. I think it's extremely important to trust that someone tells you that they are in pain, even if so this is extremely important. And as a young woman, there's actually research shows that women, and especially young women, are not taking seriously very often when they say, I am in pain. So I have had very, very great doctors, and I have had really shit doctors. And if I wasn't proactive enough to go from the shit doctor or know that it was a shit doctor, my first urologist was absolutely terrible. She misdiagnosed me with polyps. She said, I'm going to help you. And then after 3 months, she was like, I can't help you. Like, go away, basically. I have bladder pain. And it doesn't show up in the results as cystitis. Don't dismiss it. This is the key, I think. When someone says I have pain, no one would say that if it wasn't true. No one wants to go to the bathroom every 10 minutes. It's an awful, awful life. If you go to a park here, they might have it, but they might not. And the thing is, with toilets, you need like a tech savvy society, right? Germany is not so, they don't like tech as much as the Netherlands or the UK. So you would need an app for toilets. And then it would be really good if cafes, bars, and restaurants would offer their toilet on the app. right? Because there aren't that many public toilets, especially not actual public toilets where you could go, you know, that's not just used by some junkie or, you know, like, just actual public toilets, or like private toilets, like in cafe, bars, restaurants. This would be the best, and that there's an awareness that, you know, sometimes I walk around and luckily I don't have it as much, but back in the day would be just the pain is so severe, and people, you know, I would go into a bar and be like, please, can I use your restroom? And sometimes people would be like, no, you need to buy some ice cream first, you know, like, and you're like, I am just, it's so bad. And it's not like, I don't know, people, when you see that, when someone's like, oh, I need to use the bathroom, they think, oh, need to be sick or something, but that's not the case. I hope it goes. I honestly hope it will one day. I won't have it. This would be great. I still have hope that somehow I will get, maybe there's another drug or somehow another therapy. I am afraid that my fear and anxiety regarding disease will get worse, or that, you know, I also had pretty bad depression. We didn't talk about it so much, that would come back. Yeah. Yeah, I would basically, if the treatment I have now stops working, or actually I'm also very afraid that it would not be covered by insurance. But I actually really appreciate talking to you about this, because I think I don't know if everyone feels like that about it, but talking about it and someone who actually wants to listen, it really helps. And the fact that there is research done on it, I think that's so good. I really, really appreciate that. So I was actually very excited to participate.